Thank you, Samantha, for joining me today. You are a family physician working in Toronto. You have a full scope family practice, and you're also the incoming president for the Canadian Association for Physicians for the Environment. Thank you so much for joining me. Um, the hope for today is I really just want to understand like your experience as a frontline family physician, sort of managing people as you're encountering more consequences of climate change and the climate crisis. But I'd love to understand just sort of what brought you into climate advocacy as a physician.
Yeah, thanks so much for having me. The climate crisis is the greatest health threat that we face. Um, you know, the Lancet first declared that many years ago, and now the World Health Organization, the Public Health Agency of Canada, all of these organizations have come out and said climate change is a great threat to the health of people around the world and the health of people here in Canada. It's a threat multiplier. We know that the social and structural determinants of health play a really important role in whether someone is well or unwell. Things like income, housing, work, education, also colonization, racism, and the climate crisis exacerbates all of those issues. Climate change worsens precarity in all situations.
And I think the thing about climate change or the climate crisis is that the scale of it is so enormous. I think sometimes it's hard for, people, particularly, people in Ontario specifically, to recognize what is the impact that it's having on their day-to-day lives, because there are so many different facets to it. Could you give us a window into sort of how has the climate crisis impacted people in your family practice that you've directly observed?
For sure. We've seen an increase in extreme heat. Where I work in downtown Toronto and across the province, more extreme heat alerts and extreme heat events of longer duration, of higher temperatures. We just went through it's likely to be the hottest summer that the GTA has ever experienced. Um, we also see a vast increase in wildfires across the country. And those wildfires, have a local impact, and then the wildfire smoke can travel vast distances, can affect the health of people in Canada across the country. And we also see an increase in other extreme weather events like hurricanes, floods, also droughts. And so those can result in damage to property, in direct injury, and also mental health impacts. And then there's also an impact on crops and food prices because of the flooding, because of drought, because of the extreme weather events. And then finally, there's also an impact on infectious diseases. I see a lot of Lyme in my practice. And that was not the case when I was in medical school, just, 10, 15 years ago. The population of ticks that carry Lyme disease has spread a significant distance. And then there's the indirect health impacts of climate change as well. Migration and displacement is something that we're seeing more and more of, and that's true in the global South. People fleeing drought in Syria, people fleeing drought and hurricanes in Central America, but also here in Canada. The town of Lytton, British Columbia, was completely destroyed in 2021 as a result of wildfires, and that town has not been rebuilt. So that's something we're going to see more and more of.
Yeah, and I think like you've outlined, there's so many different aspects of the way that climate change is impacting our health, and sort of digging into one of them in particular. So you mentioned sort of the increased frequency of wildfires and the impact of our air quality. I recently read a study that came out of one of the universities in the States, which basically identified wildfires as potentially being one of the more huge impacts on our life expectancy in Canada because of the size of the fires and what we could expect over the next several years. What do you think people in Ontario should understand about how wildfires impact our air quality and then how that air quality can exacerbate our health conditions?
We need to be paying more attention to local air quality. And in Canada, we measured that through the AQHI, the Air Quality Health Index, which is reported along with the weather. And when the air quality is reported as Severe, everyone should modify their activities, stay indoors. And when it's reported as moderate, people with chronic health conditions, people with asthma, other respiratory conditions, or heart disease, pregnant people, very young children should also modify their activities, stay indoors, stay out of the bad air quality. And that's because particulate matter and other noxious components of bad air can cause, direct symptoms, some mild irritating symptoms like sore throat, runny nose, itchy eyes. But it can also affect lung function, exacerbate underlying conditions like asthma. And then there are potential longer term impacts that we just don't know that much about. There are some studies that have come out of Indonesia where there's been a lot of wildfires, also British Columbia, some studies from California showing that over time, with repeated exposure, there can be permanent impact on lung function, potentially an increased risk of dementia, potentially an increased risk of developmental conditions in children, things like ADHD and autism. But the links, are tenuous. Like we do need to do more research to look into what the long-term health impacts are.
Thanks. And like you said, the recommendation would be when the air quality is poor, try to move indoors. You could off the option of wearing like a good high quality mask outside if you absolutely need to. But then I think, like you said about the intersections with the social determinants, and if someone is, a precarious worker who needs to work outdoors and maybe doesn't have those same sort of occupational protections, or if you're someone who doesn't have a safe indoor space to go to, or even our kids, right, who want to be outside, want to be playing in parks, and are more vulnerable to poor air quality. It's so difficult. Have you seen any impacts in your family practice? Like, have you been seeing people with worsening health outcomes as a result of this in the summers?
I mean, there's definitely an impact on people with asthma. I've seen people coming in with asthma exacerbations because of the bad air quality. Um, and people aren't always making the link. I think we're not like conditioned to think
Yeah.
about environmental impacts on our health. And so people aren't always making the link to the bad air, especially, I think people are aware when the air quality is 10 out of 10. But when it's that mid-range 5 or 6, I think people aren't really, you don't smell the campfire smell. People aren't really making the links in the way that, we all do need to be thinking about this. So yeah, I think as a society, first of all, we need, we can only adapt so far. So we do need to stop burning fossil fuels and actually tackle the climate crisis. Um, but also we do need to implement systemic policies to protect the most vulnerable. And you alluded to this, we need clean air shelters for people who don't have anywhere else to go. And then we need protections for workers as well, so that we're not forcing people, especially people with asthma or other chronic conditions, to work outside when the air quality is poor.
Absolutely. And like you said, there's a lot that we probably should be doing from a provincial lens to try to not only adapt and sort of mitigate these sort of climate effects, but also prevent worsening climate effects moving forward. I'm not sure if you're aware, but just this past year, the Conservative government cut 42 million from our wildland firefighting budget in Ontario. And then we subsequently had a record-setting summer for wildfires in our north. What would you like to see from the provincial government in terms of addressing issues of wildfires and air quality and air health?
Yeah, instead of cutting from, wild firefighting budgets, we need to be investing more in firefighting budgets. And we also obviously need better carbon emissions targets. So reducing the pollution that is created in Ontario, the carbon pollution that is created in Ontario, and the other air pollution that is created in Ontario, because the two exacerbate each other, right? Um, and uh, and then we need to be investing in renewables, which not investing in more fossil fuels like gas, in order to reduce the carbon emissions we're creating in Ontario, in order to tackle the problem at its root.
100%. And we've talked a lot about sort of wildfires and air quality, but there was also something important that you mentioned kind of at the top of this discussion, which was sort of the increased frequency of extreme heat events and sort of, every summer becoming a new record-setting summer for temperatures. Could you tell us a little bit more about sort of the impact of extreme heat events on people's health, and then some of the things that you've tried to do in your clinical practice to mitigate that?
hmm Yeah, I mean, extreme heat is a silent killer. The 2021 BC heat dome event was the deadliest weather event in Canadian history, killing between 600 and 700 people. And 98% of the people who died indoors. So this is something we need to be aware of and we need to be tackling. Extreme heat can exacerbate underlying chronic conditions like respiratory conditions, heart disease, kidney disease. Um, and then it can, cause direct heat-related illness. So heat exhaustion, where you generally feel unwell, nauseous, dizzy, and then that can lead into heat stroke, which, classic heat stroke has a 50% mortality rate. So heat stroke is deadly. Um, and those who are most vulnerable are, you know, people with chronic conditions, but also really the elderly, so those over the age of 60, and especially people who are isolated, and especially isolated elderly people who don't have air conditioning in their apartments. So that's who died in the BC heat dome, and that's who's at risk here in Ontario. Unfortunately, Ontario is not tracking heat-related illness and heat-related deaths. And the chief coroner of Ontario has declined to track these deaths, unfortunately, even though other provinces like BC, like Quebec, are tracking these deaths.
Okay.
We do need to track the deaths so that we know where we need to intervene, so we know who is most at risk, which communities in Ontario are most at risk. Um, and then we need to intervene by providing cooling devices to people who don't have access to them, and providing, centralized cooling shelters as well. But the problem is that the most vulnerable are those who are not as mobile, may not have access to information to find out about cool shelters, and may have mental health conditions that don't allow them to go to public cool spaces. So we really do need to be providing universal access to indoor cooling devices for, especially for renters. And the City of Toronto, City of Hamilton, other municipalities are looking into a 26-degree maximum indoor air temperature bylaw, which would mandate that landlords provide cooling devices, or maybe it's through other means that we make sure that indoor spaces are 26 degrees or cooler. That's the temperature that's been found to be safe. And the province could step up. The province could step up and implement such a thing as well.
Yeah.
And you had asked about in my practice. So something that I worked on this summer with Health Providers Against Poverty and a local community organization called CREW in St. Jamestown, a downtown community in Toronto. So we went into buildings in St. Jamestown and I provided prescriptions for air conditioners.
Awesome.
And that's because people on social assistance, OW and ODSP, are eligible for funding for an air conditioner with a doctor's note. But most doctors aren't aware of this program. Most clients aren't told about this program by their OW and ODSP workers. So we went into the community. We wrote about 100, a little less than 100 prescriptions for people to get funding for air conditioners. And that is really a life-saving device for people.
Absolutely. I think that's such a game changer and obviously like amazingly innovative of you to sort of, find the ways to use your clinical knowledge to be able to sort of address that gap that we're seeing kind of structurally for people in terms of their health. Um, and I'm so glad you brought up because that is also something that we've been talking about at the provincial level is, we do have these minimum temperature bylaws that, landlords are required to adhere to because we recognize the impacts of extreme cold. But we're entering into a new era of, really the main threat that we're encountering now is extreme heat. And we need to be protecting our renters. I know in Hamilton that's a tremendous issue because most of the folks in my riding, 60% are renters. So yes, I completely agree. We need more provincial action on that level as well. Um, and you mentioned, some of the other health effects of climate change that people in Ontario should be aware of. How also could our health system become more climate conscious?
Yeah, there's so much to be done to both adapt to climate change and also to reduce the pollution that the health system is creating. The health sector in Canada is responsible for about 4.6% of Canada's total emissions, which is like the same as the aviation sector. So,
Yeah.
a pretty big chunk actually. Um, and Canada also is one of the top three most has our health sector is one of the top three most polluting health systems in the world. Just after the United States, essentially tied with Japan. So we create some of the most carbon polluting healthcare in the world. So that just means that there's a lot of work that could be done to reduce the pollution that we create. And there are a lot of organizations and universities and health systems that are working to reduce the waste and reduce the emissions caused by the health sector. One thing that I've been working on is a small hotspot in the health sector, metered dose inhalers. I don't need to go into too much detail about it, but those little puffers that people with asthma use and people with COPD, they contain a propellant that's a very powerful greenhouse gas. So one of those little inhalers is about the same as driving 200 kilometers in a gas-powered
Um,
vehicle. Um, and there are alternatives that are less polluting. So we've just been working to encourage healthcare providers, encourage patients to consider switching to the less polluting version of that little inhaler. Yeah, there's so much more that can be done and that ought to be done in the health sector to reduce the waste. Not just plastic waste, although that is what I think most people think of when they think of pollution is like the plastic waste in healthcare. That's actually a very small percentage of the climate pollution that's created in the health sector, maybe like 3 or 4%. More of the waste is like the excess testing that's done, unnecessary MRIs, unnecessary blood work, and then also the unnecessary prescriptions. Like oftentimes we prescribe in cases where an alternative treatment is available that is not a pharmaceutical, that is less polluting.
That's fascinating. Um, and I'm going to ask you, so what would you like to see from our provincial government in terms of taking some leadership on climate action? What would that look like?
I think we need a sustainability strategy in the health sector, talking about um, health sector emissions still. But are you talking about more broadly?
I think both. I mean,
Yeah.
certainly because, the health sector is within the provincial government's mandate, it would be great to see some leadership there, but also more broadly, sort of what climate policies would you like to see come from the
Yeah.
provincial government?
Yeah. So in the health sector, I would like to see a sustainability strategy,
Right.
targets for reducing pollution within the health sector, and then also an adaptation strategy, because I'm not sure that our health sector is really, ready for climate disasters. Evacuation in the case of wildfires, for example. Even like, I don't think that majority of hospitals are prepared for the co-occurrence of extreme heat and a power outage. That just actually terrifies me. So that's on the health sector side. And then more broadly, I mean, we need obviously a much more ambitious climate plan. Stop investing in gas-powered electricity, stop investing in the expansion of gas hookups. Instead, we need to be going in the complete other direction, really investing in renewables, solar, which is so cheap these days, and wind and batteries, and reducing regulation so that more people are able to access solar, since it is so cheap these days. And Yeah, and then an adaptation strategy really as a whole province as well. Thinking about, yeah, what are we going to do in the face of these increasing weather events, increasing extreme heat?
Totally. And I think the thing that I've heard, because sometimes I've gone, door to door, and we did a recent environmental canvas where we talked to, our neighbors and our community members about their climate concerns. And I will say it is really prominent. Like people will have told me that, climate change, the climate crisis and the effects on health and, our environment more broadly, like they're the things that are keeping people up at night, worrying. And rightly so. As you said, it's the greatest, threat to our health of this century. Um, Could you give me, and I've always sort of subscribed to the belief that sort of action is the antidote to despair. And I would love to give, people in Ontario some tools as to actions that they can take if they are feeling really concerned about the climate crisis, if they do want to, take action to try to protect their health. What do you see as some of sort of the tangible steps that, a person in Ontario could take to try to, get into the fight for climate action?
Mm. Yeah, I mean, I think the most important thing is get politically active because actually, I think a mistake of the last 20 years in the environmental movement has been to put the onus on the individual, and like using less waste, that's great. And it makes you feel better, and that's wonderful, but it's not going to solve the climate crisis. So I mean, individual action is a good first step, but it is not enough. Switching your home heating to a heat pump, all of that is great. And we need to get politically active. We need to demand better from our governments, all levels of government, municipal, provincial, especially federal, like
Yeah.
also no more investment in pipelines, please. Instead, we need to be investing in the green energy transition. And that also means investing in workers and making sure that workers are protected from, you know, job loss during the energy transition. Um, and so yeah, I think the way to get politically active is to join a local group. For our kids is like one great group of parents that are advocating for climate action on behalf of their children. There are so many wonderful climate action groups, depending on where you live, and I think that's a great way to also build community with other people who are worried and wanting to take action. So I mean, I think that's the main thing. Um, uh, yeah, in addition to the small things that individuals can do.
Yeah, I totally agree. I think there's been some real tricky framing in this about, we should be making different consumer choices. And of course we can, and that does its small part. But I think while we're sort of stressing about, switching from you know, uh, disposable paper towels to a reusable version, we have these huge systemic forces propelling us further into the climate crisis. And so it's really about shifting, what does individual responsibility mean in the climate movement? It doesn't have to be restricted to, our consumer choices or our day-to-day behaviors like walking to work versus driving, although of course those things are super beneficial. Um, but really it is about what is our individual responsibility in terms of demanding more from our elected leaders and those who are supposed to be stewarding us into a sustainable future. Um, so
Yeah.
thank you so much for this. This is so helpful, and it's just so nice to speak to someone who's both on the front lines and then also investing so much in climate advocacy. So thank you so much for your work. Um, is there anything else you wanted to add to this conversation before we wind it down?
Um, I think I've said it all. Get politically active is the most important thing. Take that individual level action, but also don't feel too guilty when you're not able to, because we live in a system that is built around burning carbon. So we need to change the system.
Yeah,
That's the most important thing. Yeah.
totally agree. Thank you, Dr. Green.
Okay, thank you.